Have you ever tried to persuade someone to do something good for their health? Maybe it was encouraging them to give up smoking or to exercise more often, or maybe lately to get their COVID-19 vaccine. If you answered yes, then you probably know it's not always as easy as telling them to just quit or just go to the gym and go get your shot. And that's because health persuasion is really challenging, and it's challenging for a number of reasons. To start, we don't really have a great sense of what makes a message consistently persuasive. For example, encouraging someone to get a yearly mammogram might require a different communication strategy than if you were persuading someone to stop consuming alcohol. Additionally, different audiences are motivated and biased by different things. So, some individuals are promotion focused, which means that they're more eager to pursue success or gains, while others are prevention focused and prefer to avoid losses at all costs. So, how do we know then what makes a message persuasive? And then, how can we use that knowledge to improve health? Well, my name is Callie Kalny, and I'm a PhD student at Northwestern University, researching answers to these very questions. In my lab, I use communication and behavioral theory to design and test messages that are related to health. I'm especially interested in what kinds of strategies can be leveraged to make communication more effective and more persuasive. One of the main communication strategies that I'm interested in is the use of gain and loss framed messages in public health campaigns. So, a gain framed message would emphasize the benefits of engaging in a recommended behavior, while a loss framed message would emphasize the risk of not engaging in a recommended behavior. And the thing about these frames is that they're differentially persuasive, which means that what works for me might not work for you. So it's easy to think about this using vaping, for example. So, in the context of vaping, a gain framed message would focus specifically on the benefits of not vaping, like you'll have a healthier heart, while a loss framed message would focus more specifically on the harms if you were to continue vaping, like you'll get addicted to nicotine or you might get lung damage. And in fact, you've probably seen a lot of loss framed messages like these because they're overwhelmingly used in public health campaigns. But research suggests that they're not that much more persuasive than gain frames, and oftentimes they're not very persuasive at all. And this is really frustrating because we know, especially over the past year, that effective and strategic communication is vital to improving public health. And so my research is really working towards establishing what additional message variables might make messages more persuasive for broader audiences. Because simply words matter. And in many ways, the way we talk about healthy behaviors is just as important as the behaviors themselves. And so ultimately, my goal is to establish best practices for persuasion so that we can improve the health of our communities one message at a time. Thank you.